Hello and welcome to Shinki University. Thank you so much for coming back to this channel. If you're new here, please don't forget to like, subscribe, and share. We have new videos coming out every week on amazing Japanese acupuncture, and I'd love to share that with you, and it's completely free to you. You can always change your mind. Today, I am interviewing the amazing Patti Polman, who is just a beautiful Japanese acupuncturist who works out of Colorado. I first met Patti here actually on an Iyashi no Michi workshop. And I was just amazed at her technique and the amount of study that she has done in the past. So I really wanted to present her here on this channel. So without further ado, the amazing Patti Polman.
Hello.
Hey, Patti. So tell me a little bit more about you and your practice right now.
Well, my practice, I've been doing Japanese Meridian therapy for almost 27 years now. It's 27 this month. So I studied Japanese acupuncture and practiced it pretty much exclusively for at least 24 to 25 years of that. Was very fortunate in meeting a teacher early on and had the intention of studying Japanese acupuncture and hopefully practicing it exclusively. So I do family practice. So I treat all members of the family, everything from babies to elders. And I very much enjoy that. I love treating an entire family unit. It's very enjoyable for me. And I don't really restrict myself to just treating one type of thing. I feel like the style that I've studied really allows me to treat most anything that comes my way successfully. So I just love treating all kinds of things. And of course, things like to come in patterns, it seems, through your office. And that's always an interesting theme to observe and try to understand what it's trying to teach you.
Mm-hmm.
So, yeah.
Well, you mentioned, I know Patti and I have known each other a lot for over the past, 2-3 years, I think, right?
Yes. Mm-hmm.
And I've had the pleasure of receiving Patti's treatments, and they're just amazing. And so we've talked a lot, but maybe could you take me back to the beginning and just tell me like how you originally found Japanese acupuncture? You mentioned your teacher and that you were doing Japanese Meridian therapy. Could you go more into that?
Sure. It really was sort of a number of synchronicities that all sort of came together that brought me down that road. Actually, originally with my own health pursuits, I fortunately was guided. I was a dental hygienist at the time and was working for somebody who called himself a holistic dentist. And when we were discussing that I had this health issue, he was like, I think you really should consider seeing this holistic doctor in Boulder. So I went and saw this doctor in Boulder, David Luce at the time. And he had a very interesting clinic that had acupuncture, nurse practitioners, a lot of people that, were in a group that it wasn't commonly seen at that time. This was in the late 80s, early 90s. And, or even before that, actually, this was probably in the early 80s. So actually I went there and I started on my health journey, and ultimately, things were getting better, but then they both said to me, the nurse practitioner and the MD said, I think really, if you want to get to the root of this, you should consider seeing our acupuncturist if you want to go deeper with this. And I said, I do. So I started seeing a Japanese acupuncturist in Boulder, David Scrimger, who also studied with Mikishima, like Butch Levy, who I know you've had some connections with as well. And so my time with David Scrimger really introduced me for the first time to acupuncture. Mm-hmm. And early on, even though I wasn't even really thinking, although I was very interested in what he was doing, and it just opened up a whole new world for me because I came from the Midwest. So I had no exposure to natural medicine at all. So when I started my personal journey with my own health and then experienced acupuncture, it was a real, oh my God, moment. But further, he said to me, I do a Japanese style acupuncture, and just with your sensitivity, if you ever think of getting into this yourself, you should really think about exploring Japanese acupuncture yourself. And so I really took that to heart. And so some years later, I ended up doing dental hygiene work for 18 years, but
Wow.
some years later, I was, I really got very interested in alternative things the whole time I was in dental hygiene. And then at some point decided that I wanted to expand my horizons and do a whole body medicine. So I decided to get into acupuncture. And I went to CSTCM here in Colorado, and it was just like its second or third semester of the existence of the school. And of course, there was no Japanese acupuncture there. But so I did my education there. But when I finished, well, even before I finished, I remembered David Scrimger's words. And so I actually started studying with Mikishima a little bit in my spare time while I was going to school. So I met Butch, and I met Mike, who also worked with Michael, who worked with David Scrimger, and I think they were working together in a clinic doing Mikishima style Japanese acupuncture. And so I did some of those workshops early on, but quickly learned that I couldn't do it all. So then just sort of finished my education. But then when I was done and I was actually out in the field working, I ran into some people over a lunch hour, and they were like, "Hey, aren't you one of the acupuncturists that said that they were interested in Japanese acupuncture?" And I said, "Yes." And they said, "Well, this is your lucky day, because we actually are bringing this teacher from Boston who's a Japanese trained teacher, and he's going to be doing an 8-weekend series over 8 months. And would you be interested?" I said, "Absolutely." So that was where I met my teacher, Koi Kuahari. And Sensei Kuahari and I started on a long journey together, and I began my study in Meridian therapy with him, and just really loved it. It just really spoke to me on so many levels. And so I studied with him really pretty solidly for 10 or 12 years, but then actually off and on ever since then.
So there's a lot of things that you were just talking about that I just want to go back to. One, you were mentioning in the very beginning, before you went to school, that your acupuncturist had told you that because you're so sensitive, you want to be I forget exactly how you said it, that you want to be careful with TCM, or that you want to.
I just said, I think you might want to consider Japanese acupuncture because of your level of sensitivity, because I think you'll attract people who are sensitive, and you are sensitive. So I think you'll be happier with your results with the acupuncture as well. And I really believe that's one of the biggest assets of Japanese acupuncture. I really believe that our culture is very sensitive. The majority of people that come to me, but I think it's not just me, I think it's Americans in general, are sensitive. One of the reasons I think is because we're a culture that pushes ourselves so hard, and we, a lot of people's nervous systems are really revved up, and people just need something that's very soothing and balancing, and almost universally. And I think, this is probably true with traditional Chinese medicine, acupuncture, although for sensitive people, it may not be so, that usually at the end of every acupuncture treatment, universally, people just are like, "Oh, do I have to leave? Can I just lay here on the table for a while?" Because, they haven't felt that really parasympathetic state of relaxation and calm that acupuncture brings. But I think especially Japanese acupuncture, because it's bringing a balance to the body that does put us into that calmer state. And it helps our cells remember that state. It helps us to be able to recapture that when we need to find relaxation, when we're in our stressful days and moments in our life.
So how would you, and this is kind of going off on a tangent, but just for those who are watching this, who maybe only practice TCM, or maybe they practice Korean style, or just something that is not Japanese, how would you explain how you feel Japanese acupuncture is more uniquely geared towards a sensitive client rather than TCM, for example?
Well, I think a lot of it is the refinement that the Japanese brought to the techniques. But in my experience with studying traditional Chinese medicine and acupuncture that's offered through that system, even though I read about those techniques, in a lot of the foundational texts, nobody ever taught them to me. They were more, um, let's see, just allowing the chi to regulate by inserting to a certain depth, which is described in all the texts that describe point location and depth of insertion. But nobody was really doing those techniques that they were talking about as far as what is tonification, what sort of needles do you use for tonification, what direction of the meridian do you go, and for sedation, what do you do differently, and what are all the different kinds of stagnation and stasis that you might find, and how do you address all those different levels in the body through techniques with the needle. And so the Japanese techniques are so much refined, and there's so much of a focus on those specific techniques that usually and often are even non-insertion. Most of what we're taught is non-insertion. And so it really requires a certain mindfulness and technique and presence of mind in the moment and in the exchange of energy, which I very much enjoy. And I very much enjoy also the way that it trains you to sense energy in your own body when you're connecting with another person's energy and trying to help direct the chi through the needle. So those particular techniques are really somewhat exclusive, as far as I know, to Japanese acupuncture, and most patients find them very soothing, no discomfort at all, because a lot of Americans have an aversion to needles in general because they don't have very good relationship to needles to begin with. They've had bad experiences, and
say the least.
Yeah, and they can really experience any unusual sensation of experiencing their own chi as maybe discomfort, even though it may not be that uncomfortable, but it's different, And so sensations sometimes are experienced as pain,
Well, I'm curious too, and I think that was a beautiful explanation. I really, before I get into my next question, I really love how you're relating the refinement of the technique back into how you were saying how you relate to your patient and how you can relate to the key in your patient, because really for the Japanese, that's all considered key, like relating to your patient, trying to understand your patient, all of those words, that phrases they would use to describe, that all have the word key in it. And so I love that you were also utilizing the word key there, because it really does summarize a huge ball of theory, I guess you could call it, where that the Japanese are really trying to take technique to utilize technique to really relate to the key of the patient, and that technique is the key to opening up so many different places within the patient. And yeah, it was just a beautiful way to explain it. But I am curious too, you were saying you found Kuwahara sensei. It was Kuwahara sensei that you studied with, right? Yeah.
Yes.
That you found Kuwahara sensei. I was wondering, because I think you're one of a few people who've had a very lucky experience to study with a practitioner who was originally trained in Japan, which is just a phenomenal experience. And you had a lot of in-depth training with him. I'm wondering if, as just a side question, you found that because of that training, you've been able to kind of navigate your path more in your acupuncture journey.
Oh, well, that's for sure. I mean, I think it may be one of the reasons why I'm one of the only acupuncturists who's made such a career of just trying to exclusively practice the Japanese style, because and even that leap from going from traditional Chinese medicine to Japanese acupuncture was a leap of faith in a way, because I thought, are people going to think I'm doing anything if I'm just doing touch needling and not inserting? Because I had been treating patients for a couple of years at this point. I was in a medical practice with some MDs, and my schedule was a certain way. And I remember the very first patient that I had where I decided this is the moment. This is the moment where I'm going to do a full-on Japanese style treatment on her. And the results that I got were tremendous. And from that moment on, I just didn't look back. I just said, all right, this is the moment. I'm going to do it this way. And I'm just going to continue doing it. And I even kind of cut back from some of my herbal practice because I was practicing traditional Chinese herbal medicine. And at the time, doing kind of a blend of some Japanese techniques and traditional, Chinese acupuncture. But then I kind of went to traditional Japanese acupuncture and traditional Chinese herbal medicine because I hadn't learned Kampo. I did a little bit with Mickey, but I felt more confidence in what I had learned, with my long education at CSTCM. So I stopped doing the herbal for a while because I just wanted to really see what are my results with the acupuncture alone. I wanted to really refine what I was doing and be really certain that what I was doing with the acupuncture was what was creating the results.
I mean, and that's just really what you did is exactly what I recommend my patients to, my students to do. What I just had a free webinar today. That's what I put in that's one of the main things of the webinar is have foundational dedication to one student and one style, because when you take out all the clutter and just really zone in on one student, one style and one teacher, you're able to really start to mimic them, really enact exactly what they had told you. You're able to start play with the information that they told you, and it just takes away all of the question marks that you might have had by mixing in TCM or mixing in the herbs. And even with taking out the herbs, I mean, I've been told by my teachers several times, like, if you want to do herbs, that's great, but only start doing them once you have 100% confidence in the results that you're going to get with your clinical acupuncture mock session, because otherwise you're not going to be sure what really did what. And so,
exactly.
I just really, really love how you did that. And we're very methodical about it because it just, that's probably why you're so good, to be honest. Probably.
Well, I think it takes that. And, I think working in, the small groups, sometimes where, we are, Kazato and doing, somebody on, practitioner on the table, somebody on the pulse, and somebody actually doing the treatment and getting feedback and giving each other feedback and trying to find the live point and all the things that I know you teach. I think it's really critical. And I did that. And then I actually did like 2 rounds with the Toyohari Society because I wanted to see what the difference was, because unfortunately, my teacher was no longer associated with them, even though his primary teacher was Fukushima Sensei, who of course started the Toyohari Association, but because he was studying some other things, and they're so dogmatic, they said you can't really be associated with us anymore, because he was doing some other spiritual things along with what he was doing. And so I was curious about the difference between what the Toyohari groups were doing and what my teacher was doing. And so
well, and Toyohari too, I actually kind of love the dogmatic approach to Toyohari, because I think it's one of the few associations outside of Japan that have really been like, you have to do it this way with this technique, and it's very methodical about it. Like, you have to come and study in Japan. Like, they're very methodical about
that's right. They don't want to try new things for the same reason that we just talked about. They don't want to, their group decides, look, this is the process that we take. This is tried and true. We're not going to diverge from that unless we decide that somehow will, improve upon this particular process. And, I think that's what makes it so successful, is that it's mastery. It's really taking what appear to be very simple things, but they are not simple, because the way that you have to be centered in yourself, the presence of mind that you have to bring to each moment and each exchange with your patient, the honor that you have of actually being invited into a therapeutic relationship with them and realizing that it's an honor, that sort of thing actually begins the healing before they ever even walk into your office. And so it's,
so well said.
to me, it's an amazing thing. And the only way that you learn that is with the refinement, which is what they are the masters of themselves. And we're lucky that, it's been
Yeah.
shared with us, honestly.
Yeah, well, it's funny. I was watching on YouTube the other night about a Japanese master craftsman who makes shogi pieces, which are these little pieces for like the Japanese version of chess. And the commentator was saying, look, he's teaching us all about these shogi pieces, but as he's talking, he's like already on to the next piece. He's already carving the next piece. He doesn't want to waste any moment. Every slice of the knife is exact and refined and thought through. And I was thinking as I was watching this, I was like, that's exactly what my teachers do. That's exactly how I was taught. Like, there's no difference. I mean, obviously I'm not making shogi pieces and neither are you, but like that kind of refinement and consistent locomotive movement of being exact technically while applying it clinically is just, I mean, we're all pretty privileged to have had that information, and I'm curious, you were, sounds like you had an amazing teacher who was able to really coach you up until this point. How would you say that that's really changed your practice? You started to talk about it a little bit when you had that first patient that you just did Japanese Meridian therapy on. I think it was Meridian therapy at that point. And that how you just got completely different results and you never looked back. How would you say your practice, though, overall has changed from the implementation of it to beforehand?
Well, there are more and more people now that are searching out Japanese acupuncture. And so they find you, some of them find me from, California, or, when they tell their practitioners they're going to be moving to Colorado, and they let me help you find somebody who's also practicing Japanese acupuncture. So people tend to look for it once they've received it and they know that they respond really well to it. And they like the gentleness of it. They like the response that they get to it, and the balance that it can bring to their system and the self-healing that it promotes. So I think it's been a few things that's changed. One, again, it's the type of person that I attract to my practice. Some people look for you just because they're like, look, I can't even say the word needle without sweating. I go into needle shock, and so, I would really like to try this technique because I've heard that I would really benefit from acupuncture, but I really can't imagine the idea of somebody inserting needles. It's just even the idea of it, even though I know it's not supposed to hurt, and that sort of thing. I also think that the whole frame of mind that it has sort of catapulted me into studying has it led me eventually to heart-centered meditation, which was something else that really shaped my, like you said, key interaction with people. I had to find a way to really be focused in myself and have the presence of mind that I think is really important to be able to do the refined techniques that we learn. And so because Kuhara Sensei did try to teach us a lot of things. We did all kinds of exercises where we would all feel our pulse while we were all like, emitting negative energy towards somebody up at the front of the room, and then they would feel their pulse, and he would show us how he would choose a bottle of wine based on how it affected your pulse. And I have learned one of the most important things that I try to convey to students is that you have no idea what you're overlooking if you don't use the body as a continuous reference to how effective you're being. If you don't continuously check the pulse, I don't care what kind of acupuncture you're doing. You have this body right here, and it has all the information. The person gave you information and that intake, and that's really helpful, yes, but most people that come to you are extremely complex. A lot of times you're seeing people that you're the end of the line. They've tried everything and people don't understand what's going on with them. They have been given a lot of things. They're not working. Things are getting really complicated. They're very frustrated, and they've heard maybe this is going to help them. And so you have some tools to take something that's very complex, try to simplify it, and just see what you see in front of you in that moment and navigate that. And then you don't have to wait a week. You can, like, or however long till you see them again, you can feel the pulse, you can feel the abdomen, you can touch, the key, and you can say, wow, something changed. And I trust that the next time I see you, you're going to tell me something got better or something happened.
But it's so important. I mean, I really think it's important to restate what you just said, because I think it's so important. And I say this all the time when I'm teaching, and I think it's something that's really missed in a lot of people's education, is that if you don't use the body as a continuous source of information, I just love how you put that. The body is just a continual feedback loop. It's going to tell you exactly what's going on with it, and if you helped it or if you didn't. And if you're not utilizing that, it's such a waste. It's so important. And I love that you're teaching that to people, because again, it's just something that I found that's really fundamentally lacking, unfortunately, in the educational model.
Oh, I agree. It really is. And that's why I make it such a point of, I say, if there's one thing I want you to leave this class with, it's that you will begin to use that reference point that's right there on the table, the most important one, which is the body, which is giving you all the information you need. And, listening to the breath of your patient, listening to their breathing, just, and it's amazing because a lot of students, and even when if somebody's observing in the clinic, and I'll have a student on a pulse or something, and I say, okay, now feel what happens when I just even stroke this meridian, because I'm asking the body a question right now, and the pulse is going to give us the answer. And when they feel that, they're just like disbelief all over and just, jaw falls open. And it's such a wonderful moment, because I feel like, wow, I'm just so glad you got that, that, you felt that, how much the key changes just from touching the point, not even doing that refined technique, but just asking the body, do you like this? And then the body says, do I,
Yeah. Or does I? Yeah, exactly.
And it's amazing. And it's an important thing to understand.
I think so too. Oftentimes when I'm treating students who come into my office who want to have a treatment or something like that, I like to get them involved in it, because, they can touch and feel their own bodies a little bit more, right? And to just say, like, okay, look, I'm just going to touch this one point. I want you to take your own pulse. And as you're taking your pulse, I'm going to touch this other point. Like, we'll go to the liver channel and then the gallbladder. Feel the difference. Which one felt better? And they're like, oh, it is the gallbladder channel. Or like, oh, this really does soften the pulse. And like that realization that comes to their face that, oh my God, this medicine is actually palpable.
Right. It's palpable. And, the other thing is, I think it demystifies things to a certain extent, because,
Yes.
the poetic ways that they learn pulse and all the complexities of TCM pulse taking is so overwhelming to them. And so the moment that we can actually all agree on what is an improvement in the pulse, what does it mean to have a consolidated pulse? What does it mean to have better middle chi? How can we improve this pulse? Is it deep and hard? Is it floating? And there's, the energy just feels too soft and unconsolidated, too spread, not defined in any way. And then the moment that you do some things and they feel that, and then you say, look, we don't have, let's get away from all these words of wiry, and let's get away from all those terms of description, and let's just stick with, did the pulse soften and come into the middle more and consolidate, and if we can agree on that, then, it just makes it, to me, a lot more user friendly, especially, for people who are really, just really trying to learn how to deepen this medicine and, become more proficient in it and helpful to people.
I agree. And I think too, when you start to, I mean, again, Japanese Meridian therapy, I think just as any other medicine, there's definitely emphasis on Hara diagnosis. but, really balancing the pulse is a key element to Japanese meridian therapy in particular. They really do put emphasis there. And to take this, I like to say that TCM has superior theoretical teachings. I really do think that there's so much theory, that beautiful, complicated theory that TCM practitioners learn, but it's all cerebral, right? And to take all of that knowledge and say, let's just simmer it down. We're going to look for 6 elements. Is it floating? Is it deep? Is it big or small? Is it fast or slow? Let's just look for these 6, right? And we're just going to simmer it down, and then we're going to put it into our hands. It takes a theory and makes it palpable, which is what
makes it palpable, because all those beautiful poetic descriptions of those pulses are really a combination of those 6 primary qualities. And so, they're just some, combination of those 6. And so if you understand that real the basic 6, you can go a lot of places with that, and I think one of the things that the Japanese acupuncture really helped me with was making all that theory that I learned actually come together in a more meaningful way for me, because I sort of sunk with meridian therapy, I sunk more into the Neijing. I know you sunk more into the Shanhan Lun, and sometimes I love referencing the Shanhan Lun with herbs. But a lot of what I really sunk into was the Neijing, chapter 69 and chapter 75, and really understanding the 5 elements and all the relationships, and more information about Taoist perspectives, and it really spoke to me, and I loved this idea of how balancing these relationships, which will reveal themselves in their quality through the pulse and through the abdomen and through the meridian palpation, and of course symptoms. I loved learning a more practical way to sort of integrate them into what I knew, and then taking it to the person in the body, and helping the person through whatever it was they were dealing with.
I love how you said that, like taking everything that you knew and making it into a more practical way to apply it. I really love how taking this whole body, because I see this with my students all the time. They come to me and either they're right out of school, or maybe they've been doing it for 10 years, and it's kind of like they're in this mode. There's so much to learn, there's so much theory, and then you have your patient, and you're like, and what do I pluck out of the sky in order to apply to this person? Which protocol applies? And it's like, what the Japanese medicine does, even if you were just to do on the 69th chapter of the Neijing, which is a beautiful chapter that is so deep, and it just explains so much, just to take all that information and go, all you need is this. Don't worry about all of that. That'll come, or maybe it won't come. Maybe it doesn't even need to be there. Just worry about this, just apply this. And when you just focus it down, how much, as you said, with that first patient that you had, like when you just did that, how much change that you had, and how much it can have a positive effect. I mean, because really when it comes down to it, while we can geek out all day about this, I could totally geek out all day with you, Patti. When it comes down to it, what our medicine is about, and what I'm trying to achieve with Shinkyu, and I know what you're trying to achieve with your teaching too, is how to make better practitioners so that they can help more people. And that's really where I think Japanese medicine is amazing, is that it's simplistic in its approach and its application, and it really does have a powerful, powerful impact without having all of the theory really to jumble you up. Or maybe you do have it, but you don't, it can be in the background a little bit, I think. I'm curious. So I know you do teach at CSTCM, you had mentioned to your students, and I know you're looking to expand a bit on that and to take on apprentices possibly in your clinic, which I am absolutely so excited about for you. What would you say is your biggest words of advice for someone who wants to either A, begin their journey in Japanese acupuncture, or B, continue on their path?
Well, I mean, I think if Japanese acupuncture speaks to you, and some of the things that are available through the study of Japanese acupuncture. First of all, don't see it as something that's a complete, left turn or right turn out of what your journey has been so far, because of the way that the institutions and things are and the national board certification is. We all have to start our journey, with the schools that are available to us now. We have to get through the tests. We have to, but then you need to make it your own. So if you know that you're somebody who is seeking to refine certain techniques and in some ways simplify, but deepen your abilities and skills, I think you'd be well suited to Japanese acupuncture. And you need to find, teachers that can help share the knowledge with you. They're out there. There's, there are a lot of them. We don't have a lot of them necessarily locally in Colorado, which is why you're really lucky to have access to Maya here, who is, sharing these real basics to get you started with the techniques. And that's essential. You start at the beginning with those techniques, with the refinement, with feeling the pulse in the body, reading the body in these different ways, refining your sensitivity around that. And whether or not you completely go into Japanese style or not, it's going to deepen and expand your experience in your clinics. And I think it's going to improve your results in clinical practice a great deal.
Wow. So, I love how you said that. If you're someone who wants to expand, simplify, and deepen your practice, then Japanese acupuncture is for you. Mm-hmm. Like it almost seems like a dichotomy. In the beginning of the conversation too, you had said, like, for people who are perhaps overstimulated, a refined and simplistic Japanese gentle approach. And while not all Japanese acupuncture is super subtle, it's so well suited for that more subtle, small changes of ki, because we're looking at the overall body and reading it so well. So whether the technique is a little bit more hands-on or not, it's so well suited for that. When you would think, oh, well, if the body isn't overactive, well, we need to just completely disperse. We need to be aggressive and disperse. But actually, no, when the body's overactive, we need to be subtle and allow it to balance. Or if you want to expand your practice, but also simplify it, that Japanese is your style, like that. The dichotomy that exists in Japanese acupuncture and probably all master crafts within Japan is just kind of, I don't know, it's always fun for me to geek out on, because you wouldn't think you could expand but also simplify something at the same time. But it's so true, you can. Mm-hmm. Awesome. Well, I wanted to thank you, Patti, because we're about ending our conversation. I really want to thank you for taking your time today, sharing your vast knowledge and experience with everyone on this channel. You're a really amazing practitioner, and I'm just really glad that so many people from across this nation are finding you, because you're just so good at your job. And I can't wait to see what you do as you start doing more and more teachings going forward. So please do keep us posted on that. If someone wanted to get in touch with you going forward, should they contact your clinic directly?
Yes, they could just contact me at jingjapaneseacupuncture.com. That's the best way.
All right, so
look me up there, and they can find me there.
Awesome. So I'll put all of that. I'll put your Jing Japanese Acupuncture link down below in the description box. And if you, I just want to take a minute too to thank everyone who has watched all the way to the end of this conversation, for taking your time and energy and effort to watch this whole conversation and just pick out all of these amazing jewels that Patti had to give us today. You are an amazing practitioner, and I'm so excited to be sharing this journey with you as you become an even better clinician, helping more and more people throughout the world. If you're new to this channel, please don't forget to like, subscribe, and hit the little bell to be notified when we put out new videos. We have new practitioner interviews and technical videos and application videos coming out weekly. So you can definitely check those out on the rest of the channel. And if you have any comments or would like to, again, contact Patti, you can put the comments below, and Patti's address will be in the description box. So thank you everyone again. And I'm so glad you were here. And until I see you next time, happy practicing.